CDC, COVID-19 antibody tests wrong half the time. The U.S. Centers for Disease Control and Prevention warned in a new guidance on their website that COVID-19 antibody tests may be wrong up to half the time. Authorities have been using antibody tests, also known as serologic tests, to determine if anyone has been infected with COVID-19 in the past. Antibody tests check the blood for evidence of an immune response to infection in the form of antibodies. According to the CDC, antibodies in some persons can be detected within the first week of illness onset. However, their accuracy is questionable and is not enough to make important decisions. The CDC said antibody tests should not be used to make decisions about grouping persons residing in or being admitted to congregate settings, such as schools, dormitories, or correctional facilities. They also should not be used to make decisions about returning persons to the workplace. What the CDC did recommend was that those who use antibody tests, such as health officials and healthcare providers, use the most accurate antibody tests available to them. They should also be prepared to test people twice to receive the most accurate readings. The CDC said the prevalence of SARS-CoV-2 antibody in most of the country is expected to be low, ranging from less than 5% to 25%, so that testing at this point may result in relatively more false positive results and fewer false negative results. Receiving a false positive might make people behave with a false sense of security, believing that they are already immune to the virus when there is not much evidence to suggest that COVID-19 infection offers immunity to later infection. The CDC said even those with truly positive antibody test results cannot assume that they are protected from future infection. Having antibodies for COVID-19 is not evidence of immune status, at least not until researchers prove the presence, durability, and duration of immunity. The CDC recommends the use of antibody tests with high specificity, which are less likely to result in a large number of false positives. These tests should also be used only in populations where health authorities suspect there are high cases of COVID-19. Patients who are currently battling COVID-19 should be given a viral test instead of an antibody test. Viral tests are used to identify the virus in samples from the patient's respiratory system.